Good afternoon. Welcome to another episode of Islamic Shura Council's Health Show. My name is Dr. Zachariah. Hopefully you're doing well with your families and enjoying the summer. We wanted to discuss today a little bit about drug addiction. It is a common problem that we see here in the U.S. and Western countries, and especially drug addiction amongst youth and teens. It is on the rise, and we want to make sure that we know the different symptoms and signs that we see so we could recognize and offer help and get help for those who suffer from this issue. Also, just as a side note, COVID-19, it's increasing again. There's the BA.5 variant and a lot of infections, although they're mild. Just take some precaution so you don't get, hospitalized or anything like that. And if you're near elderly, you need to kind of protect them a little bit more. There are increased numbers of infections and hospitalizations currently in this end of July weeks. So we want you to kind of be safe and enjoy your summer and be aware of it and keep yourself and your family safe. So getting into drug addiction, most drug addiction, the question always is, how did this individual get into this addiction and what happened? What we have are different gateway drugs that we want our kids and children to stay away from. Gateway drugs being even smoking, regular cigarettes. Nowadays there's recreational marijuana, and also in middle school, there's a lot of chemicals that youngsters sniff or smell. And these chemicals usually come from different industrial products like glue and paste and heavy markers and Sharpies and things like this. So we have to be aware and kind of cognizant when talking to our children to make sure that they don't fall into this problem, and they don't have friends that are also into this problem as well, because it's important for them to keep friends who are clean and not experimenting with such things. Smoking, of course, there's a lot of smoking and vaping that goes on nowadays amongst youngsters. And the vaping is usually fruit flavored, and although it's been banned in many states, kids still have access, especially middle school kids have access to vapes, and this is a gateway drug to other drugs. So initially, my advice for parents and for grandparents and people who take care of younger middle-aged teenagers or kids is to make sure that they're not getting into vaping or smoking or glue sniffing, these things like this, to keep them away from this, and just talking to them and asking whether it's prevalent in the school that they're going to. A lot of kids will know what's going on in their school and what's present and what are the drug problems that are existing currently at the school. So it's something normal and healthy to kind of discuss with your children and bring it up and say, hey, are there lots of kids that are, getting in trouble for drugs at your school? Or do you hear about things that are within the different classes and different people in different classes? And if there are, then, I would urge you to caution and warn your kids about the negative aspects of drugs and what it can lead to. Some signs to look for in terms of teenagers and adults that have this drug addiction problem. One obvious sign is, bloodshot eyes. A lot of people will have the whites of their eyes will have little red cracks in them. And it's not something where it's due to an allergy and it's temporary. It's something where you'll notice it on a permanent basis. You'll notice it more than often, and it's something that if you do notice in someone, it's something to take care of and kind of bring to the attention of a loved one, so that they talk to them and see what's going on. The other thing is, that's very obvious, is if you see a change in appetite, if you see a change in sleep patterns, if you see a change in weight as well. This is another telltale sign of addiction to some form of drug. If you see that, there's a quick change in weight, there's sleep disturbances, and there's an appetite change. And if you see that in combination with bloodshot eyes, that's something to kind of worry about, and actually sit down and have a talk and see what's going on with that person, and if they're going through a rough patch in life, or is this something that they've kind of become accustomed to and addicted to, and they're on it. Also, a lot of these people will have excessive absences from their work, or from their school, or from anything that they regularly attend. So if there's someone you notice that they're not attending their job or their classes or anything like that they normally, or their practices in basketball or baseball or volleyball, and they're sort of withdrawn, that's another telltale sign, as well as you'll notice mood swings as well. These people will quickly alternate between highs and lows, and in one instance they'll be very happy, and maybe a couple of minutes later they'll be very sad about something, and you'll see the drastic difference in the state, the affect of that person. That's something to look for. The other thing that we can look for that's a physical sign is a little bit of a tremor, a little bit of shaking, or no motor coordination. If they're trying to pick something up, they're dropping it all the time, they're dropping things. You notice that they can't write properly, they can't pick up things, they can't coordinate, hand-eye coordination is difficult. These things tend to signal an exogenous substance in the body if there's no other medical issues that they have, or that can account for it. So those are some things that to look for. Also, some of these teenagers or young people that suffer from drug addiction, they have a lot of secretive behavior, meaning that the normal teenager is private as it is, but these people are extra private, and they have very secretive behavior. They don't want people to know anything about them or what's going on in their life, and they're very, very lack of a better word, vigilant. They're very vigilant about it. They're very secretive in their behavior. So it's very important to kind of look for these signs and symptoms. And if you do see these things, then it's very important to approach the individual from a very caring and very open way, so that you have open communication with them. Not to judge them, or not to get angry, or not to kind of provide an opportunity for them to close off communication with you. The best thing is to open the communication and open ways that you can actually have them talk to you, and they see that you actually care about them. So be creative in that, and don't have them have an excuse to shut you off or shut down, because that's the easiest thing to do. When someone's suffering from drug addiction, they want to be isolated. They act like sort of like an introvert, and they don't want to be bothered by anyone. So you have to be tactful and very diplomatic in your approach when you're talking with them. So to get them help, the best help that they can get. A lot of them will refuse help. That's very common and normal. So you have to make sure that you talk to them in such a way, or you get professional help, or have them go see even their family doctor, primary care doctor, and let them know in advance that you're concerned about this situation and possible drugs. It's important to do that and get them all the help they can to kind of overcome this problem. The numbers of drug addiction and overdoses and things like this has exponentially gone up. If we look at charts from 2010, 2012, 2015, and now post-COVID, the numbers have gone up as well. We don't have full numbers yet for the last 2 years, but the indications are that the numbers have gone up in terms of drug addiction rates, as well as drug overdoses, as well as what they call drug suicides as well. So these three things have all gone up. So it's very imperative and important that we become cognizant of our surroundings. And if we have loved ones and young ones that go to facilities or schools or gatherings where there are others that might have this issue, we need to raise the issue with the youngsters and discuss it in a very loving and open way, so that they understand the harms and understand that the harms are much, much, much more than any type of perceived benefit or temporarily feeling good, you know. So that's something very important. And getting to the basis of drug addiction, a lot of people, you know, nature versus nurture, meaning that, you know, there's a certain percentage that's due to the environmental factors, the friends people keep, the places you go, the things you do, and then there's also a addiction risk which is related to biological factors, meaning genes and epigenetics and gender and ethnicity and stages of development, etc. So that's something to look at. Usually it's a 60-40 breakdown, where, you know, 40% people have that impulsive tendency in their genetics to go ahead and try something like that and do it, and 60% it's going to be the environmental factors. So it's a 40-60 split on that. 40% has to do with someone's genetic predisposition. Same thing, the same type of people that get into drug addiction have the same type of genotypes as those who get into gambling addiction as well. And, you know, I discussed earlier about the gateway, you know, tobacco and alcohol, and now marijuana in the U.S. because it's legalized recreationally. And even medicinal, some people take advantage of it, and they make a way that, you know, they have some type of pain syndrome where they're getting medicinal marijuana for it. So these things lead to a threshold where you get tolerance to these things, and then your body wants more and craves more. And there comes a point where the alcohol, the tobacco, the marijuana is not enough for the body. So the person sort of graduates into wanting more detrimental drugs with a higher and more numbing effect. And this is something where, you know, we see, whether it's cocaine or nowadays they do a lot of fentanyl and crystal, they call it, and even morphine. And then that's one side of it. And then you have the prescription drugs as well. A lot of people are on Xanax and things like this, hydrocodones, and they sell them on the streets and people take them. So these things all kind of jumble up, and it's the pursuit of these folks wanting more and more, and the body not succumbing and not being satisfied with what it's getting with these other lower class drugs. So it's something to keep in mind. It's something to discuss openly with your teenagers. And if you have someone that is in this condition, then it's important for you to discuss it with your primary care doctor, as well as there's drug hotlines locally. There's 800 numbers where you can call and get help and get counseling and treatment for this types of drug addictions. There's residential drug facilities where you can take your you know, teenager, and what they do is they do a complete detox. It takes about 20 days. They're a resident there. They stay, and they have a complete system there where they have activities during the day. They have meals prepped for them. They have their medications that are given to them to counteract the drug effects that they were on. And they get slowly weaned off, and they get detoxed from the drug that they're addicted to. So this is very something that's available, and your insurance pays for it, and it's nothing to be ashamed of or taboo. It's something to take care of. it's very important to take care of it. If you do have someone, even adults that are not performing their activities of daily living, and this alters all behaviors from A to Z. So whether it's an adult or a teenager, it needs to be addressed and it needs to be treated. It's very important. Again, there are detox facilities, and they have what we know as psychiatrists who are heading these facilities, and they oversee the medication management, and they'll proceed to do the detox and try to get these guys clean completely. Alternatively, there are some other natural methodologies that some clinics use with ketamine and NAD IV. They give these so that they detox the body from all chemicals, including alcohol, tobacco, marijuana, and etc. And they get the withdrawal symptoms there while a nurse is sitting with them and observing them. So this is another means of treatment to get you on the path to recovery from drug addiction. It's a very common occurrence here in the U.S., unfortunately, because the gateway substances are, promoted and marketed. So nowadays we have a lot of youngsters and young adults that are, if they're not alcoholics, they become some type of addict after that. So it's very important to keep that in mind, and it's very important to seek treatment and communicate with them. Just to recap the signs and symptoms again: bloodshot eyes, trouble with coordinating motor movements, picking up things, hand-eye coordination, writing, holding on to things, these things. And then mood swings. Mood swings are something to look for. Changes in appetite, sleep, and weight, and also excessive absences or gaps in their normal schedule. If this person is someone that you knew that was regularly attending their job or work or school, and now they have prolonged absences, that's something to worry about, and that's something to be of concern and ask them about it. And then, of course, secretive behaviors. If they have secretive behaviors and that are sort of hyper secretive, that's something to worry about as well. And then there's professional help that you can get. Again, you can go to your primary care doctor, you can go to your counselor, you can go to your therapist and let them know so that you get professional help and get your loved one on the way to recovery. There are those facilities that do residential detox. Residential detox, you're housed there for 10 to 20 days and you go through the whole detox protocol. You're under observed by nurses, and you're under the care of a doctor, and that's something where it helps a lot of these patients with this issue. If you have any other further questions or you need resources for drug addiction, please don't hesitate to contact us and to comment in the comment section, and we'll get you all the help that's necessary. It's something to kind of tackle head on and not beat around the bush about it. With that, that's all we have to say today on drug addiction. Hopefully we'll see you next week on our next show. Thank you for listening.